8:06, Needed a Morning Show. Steve, Alex, and Kevin still looking for the right answer in today's Nearly Impossible trivia. It has proven to be nearly impossible today. Yes.
People don't have regrets, I guess.
I don't know, or at least they don't have the right ones as far as the pollsters are concerned. A recent survey by Reader's Digest says the number one regret people have in their lives is what?
And it's not spending time with family or with your mom and dad or grandma and grandpa and your family. Getting married twice. I love that one. Saving enough money for retirement or having enough savings. Staying in a bad job too long. Not having kids was another one. A regret of not having children. And a couple of new ones in. Spending too much time pleasing others and not enough time on yourself.
Yes.
Not that. And
good, but no.
Didn't tell enough people that you loved them.
Ooh,
another good guess.
Another good one, but not right.
Not it. Do you want to drop a hint? You can drop a
No,
hint.
I mean,
we got to get out of here in 23 minutes.
So. I feel like someone's got that lucky answer. So,
wow.
271-1100, call, and while we're visiting with our next guest, Kevin will be happy to let you know if you are right or not. So give us a shout, 271-1100. Again, we got a big prize package at Thunder Road. We're going to draw for it tomorrow, but we need a Thursday qualifier. So there you go. All right, it's 8:07, and I'm pleased to have in studio today somebody that I got a chance to meet earlier this summer. I think he's got a great idea, and I'm excited for you to hear about it. His name is Barry Mehring, and he is the local owner of a new business in Fargo called Right at Home. And Right at Home provides tailored care plans for our aging loved ones. And so many of us, Alex, you and I talk about this a lot,
we
of moms
do.
and dads, and how are they doing, and how do we make sure that their days, their days as they get along in life are good, happy, healthy days. And, nothing better than to have them at home. So, Barry, thank you for coming in today. Great to have you on the show this morning.
Thanks for having me.
Yeah. So tell us a little bit about the kind of conversations that you are having with people right now. What are people most concerned about when it comes to taking care of mom and dad?
Well, we get a lot of calls, and a lot of times it's almost after an event, has happened, like a fall or something, and we wish they would call us a little sooner, because a lot of times, it's after some catastrophic thing or something have happened. But it's pretty typical. We'll get a call from the kids, usually, and this is the way it is. The eldest daughter of the family usually
That's
has
me.
to Alex, you have to take all the burden.
That's me.
Yeah.
Yep, I know what that's like.
We get a call from her, and she's concerned, and the other siblings may not live in town.
Yeah.
And they might live out by the lake where we service out there too, and they just can't be away from work and family and things anymore. They need help, and then just to keep their parents and happy and safe in the house.
I'm sure there are people that are thinking, okay, that sounds good. Yeah, dad could probably use a little help. Mom and dad could probably use somebody to come in and do a few things, but they probably have this 10-step plan, and you get the same 10 steps as everybody else, and they don't really get to know my family much. What do you say to someone that would have that concern?
Yeah, actually just the complete opposite. We have, everyone gets their own personal care plan and assessment, and we actually just went through a very rigorous dementia and cognitive training program in LA about 2 months ago. So we actually specialize in all this dementia. I would say, you might don't have the exact statistic, but 3/4 of probably new clients come in and have some form of dementia or Parkinson's or something. It's just become very prevalent, or maybe more aware, maybe now. So we wanted to differentiate ourselves a little bit and make this very client or person driven. So it is the complete opposite. So every person will have a personalized care plan.
Do we know, have there been studies done about being in your home and life expectancy or life, healthy life, that kind of thing that you get at home versus being in an assisted care facility? We know that there are times when certain facilities, certain things are right at the right time in the right situation, but do we have any data on that people do better in their home if they can at all possibly do it?
This is the age-old thing, and the medical community loves data, and they want to know data, and they want to know where this gets us even into a bigger segment of Medicare, and some of these other, these other programs are slowly realizing that having these clients or patients in their world stay at home can significantly save money. It can keep them happier, healthier. And so the big thing is to drive patient care for a lower cost. So yes, if you go into a nursing home, they can vary, and we can keep them happier and healthier by just doing simple things like getting them to appointments, making sure they're taking their medicine on time, and data driven, it's hard. You know, they're working more and more on that, and us as a large organization are kind of on the forefront of that. We did a study with Harvard actually on this thing where we have change in condition. So at the end of every shift, if you noticed a change in condition in your client, you would put it in, and then we'd notify the doctor of that right away, so we can catch it right up front.
Okay. The good news about this is Barry's going to be back with us, I believe, once a month here coming up over the next few months, talking about some of these issues here. So if you've got questions, then you can certainly let us know here too. Studio@flagfamily.com is always a good way to get questions in here. How do people have you come in, a couple hours a week, one day a month? What's the kind of the typical time frame that someone will hire you to come in for?
Yeah, we go through this quite a bit because there is a cost, and it's primarily private pay, and we do take some Medicaid if you do qualify for that, or if you're blessed to have a good long-term care policy too. So sometimes they will, it can vary so much. Typically maybe like 3 to 4 hour shifts, maybe 3 days a week would be a good start. But sometimes people need, typically the mornings are a little busier, getting up, taking a shower, getting dressed, having some breakfast, that kind of stuff is a little bit more typical. But I've never had a client not take more hours later. You know what I mean? So they're trying to save cost, and I agree with that, and we try to do that. But almost always they will take some more time. And it can go up to 24 hours a day too. So it just depends.
That's the best sign that what you're doing matters, right?
Correct.
When people say, hey, this has been great for 12 hours, but can you come over a couple more? Because they're seeing, man, this is great. And they like it. How much does it cost to have you do stuff like this?
We're at $27 an hour, and we're actually a little bit less than the competition in town, and we've done that, on purpose. But I don't want anybody to get super scared because we're not in it, for the money per se, and we always try to work with family members. So they, with just a little of our help, and maybe they can come spend the nights, maybe we come in the mornings, whatever, and we can keep mom or dad healthy and happy without having to be there 24 hours a day.
Yeah, that's great. And I'm assuming that your people all go through some pretty good training so that it's, you're not just getting Joe Schmo off the street, but somebody who's got some background and some training in what to do.
Are you a nurse, Barry?
I am not. No, I have an LPN on staff.
Okay. Yeah, I figured.
Yeah, we don't need to legally, actually, in either North Dakota or Minnesota, because our license in Minnesota is a basic license, which goes up to the nursing. So we do everything else. But yes, to get back to your question, Steve, we do deep vetting and training and background checks. We check all these kind of non-nursing lists that we have to do. And then we make sure all of our caregivers are licensed, so that they can drive clients around. They have a good working car. So tons of training, tons of background checks, tons of everything.
Okay.
And everyone's licensed, bonded, insured. And these are employees of our agency too, so they're not independent contractors, which is a big differentiation in the agency world sometimes, because you don't know. We know that we're insured and bonded, and you can be assured that because they work for us, they're under workers' comp and things like that.
Okay. Yeah. It's hard to find employees in this part of the world.
It is. It's
How
a challenge.
Are you guys doing?
I just came back, or not just, maybe 2-3 months ago from our annual convention, and that was by far the number one concern, just trying to get good caregivers. And believe it or not, we can charge a little bit more for our service here versus say Houston or whatever, so we can pay our people a little bit more. And they're typically females. I don't have any male caregivers at the moment, but it's still always a challenge. And then we are always competing with the various nursing homes and assisted living too, because they have a huge need for CNAs, and that's kind of the top level of our care also. So it is. I would say it's not as much of a challenge here, believe it or not, as I think the rest of the country, but it's certainly something I spend a significant amount of time on.
All right. Yeah, you don't need guys anyway. Ladies got that magic touch on stuff like
Isn't that the truth? The guys like the ladies, and the ladies like the ladies.
There you go. It works. It works. Yeah. You can find out more about Barry and Right at Home at their website, rightathome.net/Fargo, rightathome.net/Fargo. Well, Barry, thanks for coming in. Great to hear about what you're doing, and excited to hear about some of these topics that a lot of us are thinking about these days with our parents who are getting up there. So thanks for coming by. Great to see you again.
Thanks for having me.
Barry Mehring, and the business is Right at Home, rightathome.net/